Okay, and just to wrap this up really quick, so I was talking about the regulation of blood glucose levels and the kidneys' involvement in that. And so, like the liver, the kidneys can use the amino acid glutamine in order to synthesize these new glucose molecules, and that's through a process called gluconeogenesis. And so the kidneys can release the glucose into the blood in order to maintain these blood glucose levels if, for example, the individual wasn't getting or taking in the adequate nutrients. And then, as I was chatting about before, in terms of glucose and the effect that glucose itself can have on the kidney. So essentially, the excess glucose in the bloodstream can cause the kidneys to filter too much blood, and then this basically impacts and does damage the nephrons. And we looked at those functional units and how important they are in their filtering ability. And then this can cause many things, but the diabetic kidney disease is one such ramification of the disease state here. So thank you, and here are some of the references, and that is all. So thanks so much. Have a great day.